Alright, so it's 11 minutes after 8. Still on the AM show. You know, I've just had a mug of mixed coffee. I tell you what, it's very relieving. And I feel rather relieved.
Yeah. Well, I've just heard something. Is that she drank what mixed coffee mug, right? Is that what you drank?
I tell you what I've done this morning. First it was cocoa, and then it was followed by mixed coffee
mug.
Yes.
No, I was not about to say the cocoa. Because, no, as for the mixed coffee, she has to drink it because they are sponsoring our show. So whether she likes it or not, but she takes the cocoa to feel heavy. You know. In Pigeon, around the hoots that we grew up,
you know when you're
to feel gazoot. You know?
But you know when you're there are some days that you're sleepy. I mean, whether you like it or yes, that you can't do anything about.
Yeah.
And that's when mixy coffee comes in.
Okay.
Know. It helps.
Yes, true. It truly helps. Now we have some of those comments from you that already are on the social network pages, but what do you make of the issues that people raise when it comes to, well, what the economy is and the difficulties they are facing? You know,
so the point is, what is the real state of the economy? I mean, it's what the president said at the State of the Nation, what the state of the economy is what Dr. Bawumia said recently, what the state of the economy is.
Well, my candid view, what Dr. Bawumia said was not different from what we've been hearing the last couple of weeks, right? I think so, yes. But it doesn't mean that it's not the truth. That really is our state. And
but
we need to make sure...
How can we recover? How can we recover, though? How can we recover? I mean, it's one thing painting the picture. Yes, we know this is the sort of states that we're in, but what's the way forward, really?
But we've had some comments to Dr. Bawumia's address, and he says that, well, Dr. Bawumia must know that once a doctor in the consulting room makes wrong diagnosis on the patient, then the same wrong prescription will be given to the patient. This one from Baba Musa from Tamale, and he says that where was Dr. Bawumia in his economic knowledge all that while when the CD was in free fall? And now that the Bank of Ghana has put in place measures, and these measures are yielding positive results, which is why the CD is now stabilizing. And Dr. Bawumia has suddenly gained back his economic literature to now profess solutions. I think his lecture was clouded in MPP colors and not from an expert point of view. Stephen Akwesiyaga said he should give us a break, and Ignatius Obing says well noted. Kwabena Kobi said instead of the financial management to think and reflect on the finance minister to think and reflect on Dr. Pinksheet's counsel, he's going to be annoyingly defensive. He says he's clueless. Okay, so very illiterate Ghanaians will sit down unconcerned and blindfolded, and this country will collapse. Now you hear of financial institutions collapsing. Ghanaians be wise, and that's from Alexander Insia. Aivo Daniel says always confusing human beings. Who is he referring to, Dr. Bawumia, or who? Richard Kwekufrimpong, the issue in relation to the wanton depreciation of the CD saw and the untold hardships they visited on Ghanaians between 2007 and 2008 was conspicuously missing in his lecture. Dr. Bawumia was interestingly the deputy governor of the central bank when the CD lost over 30% of its value to other currencies during that period. Such blatant disingenuousness doesn't help anyone. We thank God for giving us Dr. Bawumia, and that's from Faisal Osman. And so, you know, the comments are varied. So it depends on where you're coming from. So not in terms of your region, but in terms of which interests you have.
Can we see white for white and black for black as a people, as a nation?
So he said, but for Fifi Kwete, he's not. NDC should find a way to beg Ghanaians. Governance is not about cheap propaganda. And Goka Albert said they should stop complaining about Ghana's economic crisis. We the followers are the ones suffering, but not you the leaders. You must stop talking chow, I beg. Reminds me of...
I agree.
Yeah. This one said, Doctor, my foot. Was he
oh,
not
no,
part
that's
of
not
the value?
fair. That is not
Yeah,
fair.
yeah, yeah. How can you tell Ghanaians in 2007 that 1 cedi is equivalent to $1? Oh, okay. Okay, so those are the comments we have now. I guess some of the comments are not decorous enough, and we would want them to be very civil, and then we can also just relay them to you. Okay.
But you know, we've also been talking about the Ebola virus, and the Ghana Health Service has put in place a national surveillance system towards the early detection of the Ebola virus disease in the country. This follows the declaration of a high alert for the disease, which is reported to have been crossing borders within the West African sub-region. This is very, very important. Now, the head of disease surveillance departments of the Ghana Health Service, Dr. Bedusa Kodie, says that the Ebola disease has no cure, vaccine or antiretroviral, and therefore intensive public education aimed at emphasizing its preventive measures was very, very crucial. I think this is really important, and I think as media
and I'm being told by the producer Eric Curtis Howard that we'll be speaking to officials of the Ghana Health Service on the Ebola virus outbreak, and then and then we'll so Curtis quickly will get us officials of the Ghana Health Service, and we'll speak to them on the Ebola virus outbreak in Ghana. And as we speak to them, we'll get to know what really the signs are, what needs to be done, and then we'll get to make sure that the right things are done.
So we know that it's been the disease has been reported in parts of West Africa, particularly in Guinea and in Sierra Leone, and now we are hearing of it in Ghana. Have we been able to contain it? I mean, how widespread is it? Are we supposed to be overly worried? Or this is just, you know, some kind of alert that we have to be careful about? These are the things that we want to find out from the Ghana Health Service.
Yes,
and
very soon, the producer Eric Curtis Howard will get us officials of the Ghana Health.
Is it Eric Curtis Howard that you're in love with? That's in the name?
No, I'm not.
But
He's a producer.
Doesn't it sound very British?
Well,
that's the name of an
Irish
Prime Minister.
The name sounds like the name of an Irish dissident. He's a disappointed Irishman.
He's black and very Ghanaian.
Well, so before we get to officials of the Ghana Health Service on the line to speak to us about this very latest news and what we need to do, what really are also your own knowledge about issues of public health, and especially the Ebola, I keep saying Ebola, okay, the Ebola virus. And sometimes when you take too much okra, it happens overnight. Yeah, so.
Okay, so you ate some leftover banku with okra this morning?
You have to stay with me till evening, so sometimes I guess.
But you know, we're also talking Ghana Post, the collapse. Has it collapsed? You know, that's the interesting thing. And we have the managing director of the Ghana Post Company joining us this morning with an insight. I mean, we want to know, are they making money? Really? Are they making money? Should we collapse the Ghana Post totally? We'll also be having that conversation here on the AM show. And I've seen all the comments. Hey, people, you have Facebook, so Ghana Post, you don't care.
All right. Well, so we're taking a short break. When we come back, we'll bring you a lot more. And continuously this morning, we've been talking about the Ebola virus. Well, I got the phrase right, the pronunciation right this time. And particularly because it's a concern for many public health experts, would want to have a lot more insight into it. We've been told we have somebody on the line. Yeah,
joining us right now is the director of the Ghana Health Service, Dr. Acquah Dangerah. Good morning to you, sir. Thank you for your time.
Good morning.
So we're being told that the country or the health service is on a national surveillance system. What does it mean?
What it means is that we put our what they call it, our teams on the alert to look out for certain diseases like Ebola and other things. So we are on the alert to inform the health facilities. We inform the doctors, and then we get in the technical committee to meet and then we send out the signs and symptoms for the key definition of
Ebola
what it is like. Yes, so that everybody will know that any new case, we arrest it immediately for any spread.
What is this virus or disease all about, and what form is it in?
Well, it's a hemorrhagic fever. In other words, it's a viral disease which causes fever and then bleeding tendencies in the person, and then quickly leads to death. And it's usually in the eastern part of Africa. But now, from what we hear, it's moved to the western side, and it's moving slowly towards Ghana area. And with this traveling, people moving up and down, it's very important that we now put our borders right, and then train people and get the necessary resources waiting for it.
So it is not yet in Ghana, is that it?
No.
Okay. But we are just on the lookout. So what should people look out for?
Well, what people should be looking at is the history of travel. If somebody has traveled, come back with fever, and then the fever comes with bleeding tendencies, some more break, and then you find blood swelling on the skin, and then you find some blood within the gums and so forth, vomiting. Then you suspect. It looks like malaria, but then it goes beyond. The malaria doesn't cause that kind of bleach, but this one does.
Is it curable?
No, okay, we contain it by taking care of you, by giving these vitamins and fleas and other things. And not everybody dies. Normally the death rate, sometimes 50%, sometimes it can go as high as 90%.
But do I get the understanding that you're living with it for the rest of your life?
Oh, no, not at all. I mean, it's completely, it goes away. There are a lot of viral disease comes that way. I mean, the moment you get out of the system, because it's an infectious disease, then it goes away. It means your body immune system has overcome it.
Are children at risk?
At risk? Well, everybody is at risk, and that is why we are educating people to be washing their hands and then disinfecting, and every time should not be too many handshakes, and then be handling the people who are sick when you don't know exactly what you're supposed to be. Supposed to go to the hospital at the time, and then help us in the surveillance and inform the medical authorities if somebody is come and showing something like that.
Dr. Appiah, at what point do such outbreaks become a public health concern?
It is a public health concern when even one person comes out, because one person has the potential of spreading the disease. You know, it's not known in Ghana here. So if it comes, it's like a virgin land. Fire gets into a forest area, it just blazes. But this one is the same way. So we look out for it, because you see that when we went to these other countries, within a short time they reported 30 deaths, 60 deaths, kind of thing. So it means we have to be on the lookout. And normally when you're on the lookout and you prepare, you're able to contain it and arrest it, because then you condone those areas where the disease are, and then you make sure that you give barrier nursing to the affected individual. It's when we don't know about it, that is where the problem lies.
It's been reported in the Daily Graphic newspaper of today that the disease has been reported in Guinea and Sierra Leone, and indeed in Guinea, they've banned the sale and consumption of bats. What are we banning in Ghana? Are we banning anything at all?
Well, I think it's just warning us that bats, we should be careful of handling bats. I think we should. It's that we haven't got the disease yet. So, but it's better we move away from bats and handling monkeys and those kind of things. So forewarned is forearmed.
So what sort of surveillance is being undertaken in the border towns?
Now we'll hold a technical meeting today with the WHO. And normally across the border, what we do is that when people come and we know that they are from the other areas and show that signs and symptoms, then they are put in isolation. Samples to be taken to the laboratory to cross-check that it's not Ebola. If it is, then they'll be isolated and then be treated until they are okay. So it's going to make to the general public. So all the border towns, including the illegal routes and so forth. So we are making sure that the hospitals around Hamile, Bolu, Bofu, Navrongo, Narelugu, Krati, Hofoi, Aflawo, go to Elubu, come to Tampa, come to Bidiani. Those areas, all of them have been told. And then there'll be training for them. And they also have to get logistics, something like barrier nursing. So they have to get the disposable gowns and the gloves and the goggles and the masks, face masks and so forth. So that in case of any problem, they actually help them. Because sometimes the main risk is to the health workers. You come, but they don't know about that, and they come in contact with you, they are likely to have the problem, especially if there's even any pinprick from one person, from the patient to them. So we make sure that they become very cautious.
Dr. Acquah Dentra, we'll get in touch with you again after that meeting with that technical meeting with the WHO. But thank you so much for your time this morning. Thanks for the education.
Thanks.
And I was just speaking to the Director General of the Ghana Health Service, Dr. Acquah Dentra, there on the Ebola virus. It's not in Ghana yet, but we're on a high alert. So be careful, be on guard. And should you experience or see any of the signs that was shared, make sure that you report immediately to a health facility.
You can't get this sort of public service education or information than on this very platform, the AM Show, live on the Joy News channel of Multi TV. But more importantly, if you live in any of those border towns, in particular, we know many of you patronize Multi TV a lot. You always tune into the Joy News channel. Tell us what your experiences have been. Usually, do you get some level of public sensitization when some of these perceived outbreaks reportedly spreading towards your community from the health service officials? And what do you know about it at all? Please share with us through the platforms we have.
But you know, it's interesting, Guinea has banned bats. Do we eat bats in Ghana?
Yeah, I think some areas.
So if we were to ban anything like that, what would it be? You know, any bird, what would it be?
Well, I don't. The point is that we don't have, we don't eat them in masses. We don't have many people eating. I guess cross sections. So those are the subjects I guess we have to be treating or dealing with.
Okay. So what's that question of yours to the Ghana Post?
Okay, my question to the Ghana Post is: are they relevant in this very information age?
I promise you that will be my very first question to my guests. Who is the boss of the Ghana Post? And he's up next with me right here on the AM Show. So stay with us.
We'll be right back.